Hi, I'm Kristen Knecht, and I am president of Head, Shoulders, Teeth, and Tongue. And here we are orofacial myofunctional therapists. And once a dentist diagnoses you with an orofacial myofunctional therapy issue, then you'll come see one of us and we will take an assessment. So I've talked about a few individual muscles that we've assessed in a previous video, but then we start to put them together, right? Because we don't normally stick our tongues out and move them side to side and up and down and in and out and make them long and make them fat just for the heck of it. We're doing that because we need to use all of our mouth muscles for much more complex things like swallowing our own saliva, keeping our tongue in our mouth and not back in our airway while we are breathing. Swallowing water, swallowing food, speaking, things like that. Now, I'm not a speech therapist, but oftentimes if a speech therapist is struggling to help a child or anybody with their speech, there might be a functional issue going on because speech is actually, it's a simple-ish thing and it doesn't take a whole lot of muscle and effort to be able to speak. And so if someone is struggling with their speech and they're not quite grasping the principles even after going through um, a decent amount of speech therapy, then there might be a physical issue going on. And so that's something I can assess for. Along with the individual muscles, I'm going to assess the person to see how well they can swallow. And I want to see if they are swallowing correctly by using their correct muscles and not using muscles they shouldn't be using. So a lot of people, when they swallow, they will purse their lips. You see, I got a bunch of lines around my face when I did that. My mentalis was pushing on my lips. My rosaurus was bringing my lips in. My orbicularis, which is the muscle that goes all the way around the mouth, that was definitely bringing everything in and pursing my lips, creating negative pressure and a suction so that I can get food, or in this case, my own saliva, spit, to go back towards my throat. Well, that should not be the case. If our lips are having to work really hard to get food and water and spit to go to our throat, that means the tongue isn't doing what it's supposed to be doing. And it might also mean that there's food all over the mouth and that the tongue and the mouth is not gathering the food to the tongue before swallowing, and a person is swallowing prematurely, which can lead to swallowing air and upset tummy and gas and things like that. And that could be really uncomfortable. And so I'm going to be looking for how they swallow and what is their face doing when they swallow. A face should be very still, actually, when it's swallowing. So when we chew, we are chewing our food and our lips are helping out. And they're supposed to be, right? We're going to bite into your food and the food is then going to split on both sides of the teeth. The tongue is then going to scoop that food up and put it back on the teeth, and the cheek is going to scoop that food up and put it back on the teeth, and then the teeth are going to come down again. And it's this whole beautiful synchronization process that is going on. And when the food is ready to be swallowed, all of that food should then be brought in to the center of the tongue, and the tongue tip should come to the space should sit on the gums right behind the two front teeth, right where we say N. We also call this the spot. So whenever I'm talking to my patients, I say, put your tongue on the spot. They know what to do because we talked about the spot a lot. And then we swallow. So we bite our teeth to stabilize our swallow. And then I'm going to have them open their lips often because I don't want them using their lips while they're swallowing, because we want the tongue to do its job. And we don't want anything else compensating for what the tongue should be doing. You can see all you can see that was moving was the oral pharynx, right? The tongue moves to bring that water back. It kind of undulates just a little bit. And then the water comes down and everything else is going to do its job to make sure that the water doesn't get into the airway and things like that. And it's really, really important that the rest of the face be totally still. If I'm not able to do that, if it looks something like this, right? My lips are like, oh no, 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 we're gonna lose the water. Why? Because my tongue doesn't have very much control. It's the lips have always controlled everything. Um, or if a person does this thing, just gets water everywhere. Again, that person doesn't have very much control over their tongue. They're not paying attention to what's going on, and um, and that can mean that the lips and the cheeks are having to work extra hard. Sometimes people who are using their lips overly so, and their tongue is very weak, functionally lazy, um, they are going to experience teeth that are tilted in towards their tongue. And so instead of having teeth that come straight down, and kind of have a scissor action to chop their food so that they can take a bite of something, their teeth are going to be pointed in just a little bit like this. They'll still get a little bit of scissor action, but over the long term, those teeth can start to kind of hit each other, and teeth should not be hitting right on top of each other. That will actually wear those teeth down. There should be a little bit of overlap, not a ton. It should be overlapped like this. That's a very deep bite or overbite. But there should be a little bit of overlap so that there is some scissor action, but they should be straight up and down. And so that's, I'm going to be looking, I'm going to have a person chew their food and um, and swallow and take a drink and swallow and even just swallow their own saliva, and I'm going to have them do that several times so that I can see kind of what's going on and how much control they have and how much they have to use the rest of their face. Or if they swallow and they do this thing, that means that their neck is having to help out, that their tongue might be restricted enough by very narrow space. Their tongue is having a really hard time getting up into the palate because the palate is really narrow like this. That's our palate right there. If you can put your thumb right there in on the roof of your mouth and it feels really nice and snug and it's like kind of hugged by the bone in your jaw, then you might have a very narrow palate. I definitely do. In fact, I'm getting expansion because I've been doing myofunctional therapy for myself for a long time, and I need a little help to get expansion with one of the doctors that often recommends patients to me. I've seen a lot of their good work, and so I'm going to be checking that out myself. But the problem is the tongue, it wants a nice broad space up in the palate, and it's not as narrow as my thumb. And so if my thumb sits nice and snug up there, well, the back of my tongue is going to have a hard time sitting up there all the time unless I'm constantly thinking about it, which I do all the time. And so I've actually gotten a little bit of natural expansion because I have been doing these exercises and really focusing on keeping my tongue up at the roof of the mouth. My point is, it's important to see what each individual muscle can do. And it's also important to see whether or not they all work together in synchronization. So I hope that helps you understand what it is we're looking for and why we're looking for it, and what a person can expect from an assessment from a myofunctional therapist.